Hello, everyone, and welcome to this week's COVID-19 office hours. I'm just going to take a couple moments to give some housekeeping and logistics updates before we get to the content that we have for y'all today. So first and foremost, a couple reminders and then some new information for you today about housekeeping. So first and foremost, we are recording today's office hours as we do each week. A copy of that recording, a copy of the slides, and a copy of the content from the chat will all be posted to the HUD Exchange at the link that's up there on your screen. Just do give us a couple of business days and they will be posted there. Additionally, you were likely prompted today for an event password. We are going to have an event password each week due to a WebEx update that recently occurred. The password will not change from week to week, and hopefully it's easy enough for all of us to remember. It's posted on the HUD Exchange at that link, but just as a reminder for all of us, it is HUD123 if you ever need the event password. In terms of audio for today, as always, we encourage you to connect through your phone in case that is possible. To do that, please go ahead and call in on the information that's up there on your screen, and that should appear in the chat in just a moment for you. Additionally, we will, as we do each week, primarily connect through the chat functionality, which we'll see in just a moment on the next slide. Just as a reminder to find the chat, in case you've lost sight of it, just look all the way over to the right-hand side of your screen and look for that chat bubble and go ahead and type in all questions, comments, and feedback in through there. When you are sending in those messages, just take a brief moment to ensure that you have the 2 lines set to everyone. It should default to that, but if it does not, just go ahead and scroll on down. As we did last week, we will also do poll questions again this week. This week they'll be on quarterly reporting, and we'll put that link in the chat in just a moment or so, and then we'll get more information to you about those questions when we get to the relevant content. With that, I'm going to turn things over to Norm Suchar from HUD's Office of Special Needs Assistance Programs. Norm?
Thank you so much, Natalie. And if you're participating in the chat here, Micah just put in the link to those poll questions. So the poll questions deal with QPRs and challenges to submitting the quarterly progress reports for ESPCV. It'd be really helpful to know sort of what challenges you're facing and what the barriers are, so we can do our best to make it as easy and as easy as possible. So if you wouldn't mind going into that link and answering the poll questions. There are a couple sort of checkbox poll questions, and then in some cases it'll ask you to type out a response in the chat window. It'd be really helpful. We'll be discussing those a little later in our session today. I want to quickly introduce the people who you'll be hearing from today that are presenting. Again, my name is Norm Suchar from the SNAPS office at HUD. You'll also be hearing from Sharon Singer from the SNAPS office. Heidi Schultz from one of our technical assistance provider is going to give a presentation on some technical assistance resources. Very happy to have Liz Impert from UCSF, University of California, San Francisco, with a presentation on antigen testing. So it's a very exciting presentation, a lot of great details and information in there. And we'll get our regular update from the Centers for Disease Control and Prevention from Lindsay Baranko. And we have a lot of people in the background here to answer your questions, so feel free to ask any questions related to the topics today, or if you have anything else you've been dying to ask, feel free to type that in the chat window. Also, if you have successes or challenges you'd like to share with your peers on the call, please feel free to type those in the chat window. Thank you. So with that, I'm going to turn things over to Lindsay from CDC, and she's going to give us our COVID update. So Lindsay, take it away.
Great, thanks, Norm. Next slide. We just have a real quick update today. As of April 7th, there have been approximately 30.7 million cumulative cases of COVID-19 in the U.S. The graph shows the daily trends in the number of COVID-19 cases reported to CDC, with the blue bars showing our daily cases and the red line showing the average number of cases over the last 7 days. Unfortunately, we have not seen a decrease from last week's slight uptick. So again, it's really important to continue following CDC recommendations related to the prevention of COVID-19 spread. So distancing, wearing masks. I'm also going to put in the chat box a link where you can find the specific cases in your county. Next slide. Some good news, we're up to 33.7% of the U.S. population has received at least one dose of vaccine. And some additional good news, we're up to approximately 77% of the population over 65 have received their first shot. This map shows the number of total COVID-19 vaccine doses administered per 100,000 people. And overall, approximately 112 million people have received at least one dose of the vaccine. The states with the darkest shading have administered at least 60,000 doses per 100,000 population. Next slide. And just a quick reminder that all of our guidance, resources, tools are all on our website, which I'll put in the chat. So if there's any information you're looking for related to COVID-19 or vaccines, you can check that website. And that's all I have today.
Thank you so much, Lindsay. Just a reminder, if you have any questions, feel free to go ahead and type those in the chat window. So next, I'm very happy to introduce Liz Impert from the University of California, San Francisco, to talk about antigen testing. So a lot of great details here. Just a reminder, the slide, there's a lot of content in the slides. The slides will be available next week. We will post them as soon as we can, so you will get to, download and see these slides. So with that, I'm going to turn things over to you, Liz.
Thanks so much, Norm, and thank you for having us come and join the HUD office hours today. As Norm said, I'm Liz Imbert. I am at UCSF in the Infectious Disease Division at San Francisco General, which is our public hospital, and I've been activated since the very beginning of the COVID response and oversee our outbreak team in the COVID Command Center here in San Francisco. And really excited to share with you all today some highlights from a playbook we developed for how to do rapid antigen testing in shelters. And I'll share a little bit about our experience in San Francisco, and then happy to be a resource sort of going forward if other cities have questions as you troubleshoot sort of rapid testing if you're considering that. So you can go to the next slide. So just to give a little agenda of what we're going to go through today, I'll start with a bit of a background, why we did this, the value of doing screening testing, and our playbook itself. Some key considerations as you think about potentially standing up this program or modifying a program you already have. And then I'll go into staffing and workflow, the different roles that are required for antigen testing, the workflow we developed, and then how we iterated on that workflow and got to a much more slimmed down, less resource heavy, staff heavy workflow. I'll talk about the shelter staff champion role, which is part of the team that's been really key to the success of this in shelters. And then lastly, I'll go through sort of the assay itself, how you interpret it, and what we do based on the results we get from the antigen testing. You can go to the next slide. So to give a little bit of background, which I think many people on this call are familiar with this, but among people experiencing homelessness, we see really high rates of chronic conditions and acute illness. There is the history and ongoing stigma and discrimination that's faced by this population. And while there is guidance, often implementing some of the guidance around masking and social distancing is challenging for people experiencing homelessness. And while we have approached the response for this population in a very robust way, there's still staff and resource limitations that we need to take into account as we're standing up the response. So all this going together, the population is extremely vulnerable, and testing can be one of the key things we can do to actually identify cases in folks, particularly folks who have no symptoms, and actually isolate those folks and remove them from the shelter before they spread COVID to other people. So as we thought about standing this up, some of the things that we were trying to address is testing. Folks who are experiencing homelessness may not be accessing testing resources that other people are accessing in our city. So how do we make this accessible? testing is expensive. And also, if we use PCR testing, we're sometimes waiting up to 2 to 3 days to get lab results. So those are some of the things we wanted to try to problem solve around as we were setting up our rapid antigen testing program. You can go to the next slide. So we'll talk a little bit about screening testing. I think I'm probably preaching to the choir on this, but, screening testing is really a key way to figure out, who has COVID and not just relying on symptoms. I feel like we learned this pretty early on in the response, that the asymptomatic nature of this disease and the fact that asymptomatic folks contribute to a lot of the transmission of the disease means that we really need to get testing. And the idea to really do this well is to have frequent testing, to have rapid testing, and to actually go to where people are. And then once you find someone who's positive, really having that supportive system to isolate and quarantine them. So some of the principles that we stuck to were, we got to bring tests to where people are. We have to utilize trusted messengers, having some incentives to encourage people to test, and to really have a cross collaboration between public health, the shelters, and our homeless service providers and people experiencing homelessness to get this done. And then another key thing was really, how do we get quicker tests so that we can act in the moment? You can go to the next slide. So here I'll just highlight our playbook. So this is available online through the National Healthcare for the Homeless website. It's also on the UCSF and YAF Homeless Health Initiative website. And basically it's a step-by-step playbook that really goes into, what do you need to think about as you're setting this up? How do you actually implement antigen testing? How do you think about staffing? How do you think about the workflows and how frequently you need to do this, and various considerations? So we'll give a link at the end, and we're also going to host some office hours if people have questions about this. You can go to the next slide. Okay, so just to go over some key things that we began to think about and had to think through in San Francisco as we were standing this up, I think one of the key things is just this coordination between, the shelter staff, the service providers, the public health department, and we really planned across many different organizations to really do this successfully. Another thing that you need to think about is getting a supply of confirmatory PCR tests, because depending on the prevalence, you may want to do confirmatory testing if you have a positive antigen test with a PCR test. Thinking about your isolation and quarantine support and ensuring that you have that and you have transport to those sites or on-site isolation and quarantine in the shelters. An information management system, ensuring that these results can get reported back to the state, and then ensuring that you have a CLIA waiver to actually do this testing and that folks are properly trained in doing this testing. And then sort of lastly, you need to figure out, what is the volume of tests you're going to need and how many tests do you need to procure. You can go to the next slide. Okay, so now I'm going to get into the staffing and workflow, and you can go into the next slide. Okay, so we rolled this out in January when we were in a bit of a surge in our city in San Francisco, and we have 12 congregate shelters in our city, and we started with 2 shelters, and we were able to roll this out to 12 shelters over an 8-week period. And when we started this, I will share, this is what our initial staffing workflow looked like, and then I'll share later how we modified that with the eye towards how do we make this as streamlined as possible, because this is really staffing and resource intensive. So let me go through what we initially did. So initially, we had about 3 non-medical staff that would check folks in. They would register them on an iPad, collect some demographics that the state needed, do a symptom screening and figure out, are they symptomatic for COVID or not? And then after that, the person would proceed to the step testing table. We had 2 individuals who were able to swab them and test them and actually mark the time where they did the swab. And then the individual would move out, the individual's test would move over to the readout table where someone would add the reagent, watch for the time, and then read out the results. At the results table, we had a staff that was there that was able to disclose negative results, and we would tell residents and staff, we tested both guests and staff, that they could come back in a half an hour for their results. And then two other key roles that we had. So one was the shelter staff champion, which I'll get into a little bit more about that, but that's a person on site who's part of the staff that really serves as a liaison between the testing team and the shelter itself. And then our floating nurse role. So we had one nurse on our team, and that nurse was available for multiple different things. One was to figure out if someone's actually a person under investigation, if they have symptoms or not. Because what we found is sometimes people have symptoms, but they're due to other medical problems or other chronic issues. So really making that determination, is this person a PUI and do they need to be isolated? And then they also are able to do the positive result. So if there's a positive result, they can do real-time disclosure in the moment. And then we actually trained our nurses to be case investigators. So they were able to determine what is the infectious period of this person, who are their close contacts, and then facilitate them to get to isolation and quarantine. So we basically collapsed this role of the nurse to really be a resource and really do everything that we do that often takes, hours to days, really within an hour of someone getting tested. You can go to the next slide. So this is our slimmed down workflow. So we left the shelter staff champion and we left the floating nurse, but what we were able to do is just have one staff to check folks in, and then we collapsed the roles. So we taught people how to do self-swab. So the individual who was the collector would actually ask the patient to swab, check if they have symptoms, then start the process, add the reagent, and then we just had one person who was reading out the test results. So we were able to collapse this workflow, and this is what we're using now. You can go to the next slide. Okay, so the shelter staff champion. So at each of our 12 shelters, we have a full-time staff member of the shelter who we've identified as the champion. And the sort of key role of this person is they need to be familiar with the residents and the staff. They need to serve as the primary person that's interfacing with the local or county health department. And we also provided an additional stipend for these folks during the startup period for them playing this role. And then what is their role exactly? So they are the greeter, they're the point of contact as people arrive for testing. We rely on them to communicate out that the testing team is here, to develop sort of messaging around the purpose for testing and assist in the overall program support. And then they are a go-to person when we have a positive case, for helping us to get them to isolation and quarantine, and ensuring that they have a space to isolate in the shelter while they're waiting. You can go to the next slide. Okay, so now I'll get into the test results and action process. So go to the next slide. Okay. So this is the Binax test that we use, which is one of the rapid antigen tests. And I just show a picture here, but basically once the person, either you swab the person or they do a self-swab, then you need to add 3 drops to the Binax card, put the swab in the bottom, twirl it 3 times. And then actually what we do is we mark the time on the card so that we make sure we're reading it out within 15 minutes of starting the test. And then you can go to the next slide. And you all may have or may not have seen these before, but it's almost like a pregnancy test. So basically you have to see that the control band is pink and not blue. And then if it is pink, then you're looking for the second band. And if you see a line going fully across, it's positive. Some of the work that our colleagues at UCSF did when testing in the community is they really figured out that even if the line is very faint, but it's going edge to edge, it's still a positive. And so that really helped them increase the accuracy of this test. And then if it's no band, then it's negative. You can go to the next slide. Okay, so this is how we think through results. So if someone has no symptoms and they're negative, then we tell them they don't have COVID and we encourage them to keep coming back and testing with us. And in our initial pilot, we were doing Binax testing twice weekly. Now that our prevalence has gone down a bit, we're there once a week doing Binax testing. If they have no symptoms and they are Binax positive, given that we've had fairly low rates of COVID in our city, we have always done a PCR test and we have found some false positives. So for our algorithm, if they have no symptoms but they're positive, we get a PCR test and we ensure that it's a real positive. If they're symptomatic, then we really want to figure out, are they actually a person under investigation or not? If they're a person under investigation, we think they have symptoms of COVID, then we're going to get a PCR test, even if they're negative, and we're going to move them to INQ. And then the sort of last category is someone is symptomatic and positive, then we just trust the Binax test, and we don't do confirmatory testing, but we do get those folks to INQ. You can go to the next slide. Okay, I highlighted this a little bit before, but just to, take a step back, before we did this rapid testing in our shelters, we would find out about a test in many different ways. We code all our shelters' addresses. We get addresses for general delivery. Our team gets notified of all these positive cases. By the time we figure out where they are and we try to get them on the phone and try to get them isolated in a hotel, hours and sometimes even a day passes by. And so now really the great thing about this is in the moment, the nurse is able to find positive individuals. Because of sensitivity with the staff, if a staff is positive, we ask the nurse to call that person and not go up to them in the shelter and disclose their status. For the guests, we have approached them in person. And then it's really exciting that they're able to figure out in the moment, do they have symptoms or not? What is their infectious period? Who have they been in contact with? And then we can get them right into isolation. And this has really collapsed the cascade for us and allowed us to rapidly isolate folks who are positive and get them out of a congregate setting. So that's really been a key feature of this. You can go to the next slide. Okay, so I went through this a little bit. We do contact the person right away. We rely on the shelter staff champion to assist us if transport's coming, making sure they are in a place where they can isolate. And then for the shelter, what's really good is that if someone tests positive at the event, we're able to message yet again to the shelter and say, there's been a positive person. If you haven't gotten tested yet, you may want to get tested. And then we notify the whole shelter that there's been a positive case. Some considerations that will depend on your setting and what your public health department says is that, if there is a positive resident, they may isolate on site or they may isolate somewhere else. Once we have a positive resident, then we augment our testing to twice weekly rather than weekly. And then in our case in San Francisco, we will suspend new admissions once there's 2 positive cases in a shelter. But every city, every place may do it a little bit differently, but those are some of the considerations you need to think through. You can go to the next slide. Okay. So here's the website for the playbook. If you have any questions, follow up from this, please email Tiffany, whose email is right here. And then we are going to host office hours in the 1st and 2nd week of May, and we will share a link later. So if you're interested in those, please email Tiffany. But I will be on those, and I'm happy to answer questions. Whether you're doing this now or not doing this now and have questions or you want to start doing this, we just want to be a resource because this has been really helpful to our city of really rapidly figuring out who has COVID and getting them out of a place where they can potentially transmit it. So this has been really great for us and we're happy to be a resource. And I think with that, I'll pass it back to you, Norm.
Thank you so much, Liz. There's a ton of great detail in here. I want to ask a few sort of broader questions about this. So if you're an organization that is operating a congregate shelter and you're sort of like, this all looked daunting, what do you suggest as first steps for people to sort of engage with their healthcare providers, or how should people think about that?
Yeah, I think that's a great question. So, I mean, I think what has been really successful here is the collaboration. So if you're a shelter provider and you're interested in getting this into your shelter as a resource, I think absolutely talking to the local health department and thinking through that with them. Also talking to the homeless service providers in your community because they are often providing a lot of the testing resources, and then other community-based organizations. So I think, having sort of a collaboration to do this together is really, really important, not only for teamwork, but also for the linkage to the, who knows who's positive and the outbreak response. The fact that our outbreak team was so integrated into this meant that once there was a positive case, we were on top of it. We were working with the shelter, working through that case. So I think it does need to be sort of a cross-sector collaboration. Absolutely too hard, I think, to do it completely on your own. But yeah, happy to think through that with folks as well.
Thank you. And you mentioned that you start with once a week as a sort of time frame. So for a I don't know how large the shelters are that you have done this in, but for a shelter that has, say, 50 or 100 residents, like how long is this process is this one morning a week, or can you talk about, and then the logistics for setting everything up and taking everything down and all that stuff? Can you just sort of talk about what kind of time and space commitment do people have? Are people going to need for this?
Yeah, definitely. So I think when our community prevalence was higher, when we started this, when we were in the middle of our surge, we were doing this twice a week. Because as you know, with the Binax test, it's a less sensitive test than PCR. And so the more frequently you're doing it, the more likely you're going to pick up someone who is maybe negative on Monday but is positive on Thursday. So when we were in that really high community transition, we were going twice a week. And even before we had Binax, testing is voluntary. So we don't require testing to be in a shelter. We don't require staff or guests to test. And so we don't get all the folks in the shelter, right? We get a certain percentage, and I think that's been the experience at other places as well. And so what we do is we usually allot a few hours to do this. So they're there for approximately 2 hours at each site. And then the shelter staff champion is really that key point person that helps them with, tables and where to set up, where it has an outside space. And that, I think that the setup and the takedown initially took a lot longer. And then once it became routinized, it was better. But I think having that point person on site that can really facilitate it was super key. And then one of the reasons that, we went down to once a week testing is because, when the prevalence went down, we were essentially doing 24 events a week, which is really time intensive. And so as the prevalence went down, now we're doing once a week and we're able to divert some of our resources to folks to do vaccine and other stuff. So I think we need to kind of right size it with where we are in the pandemic also, and we need to divert resources to vaccine, but testing is still important and will remain important for containment.
And
Norm, I lost you for a second. Can you repeat that?
No, I had myself muted, so I apologize for that. And thank you for whoever unmuted me. So the last question I wanted to ask is what was the reception from shelter residents? Is this something you had to do, and the shelter staff had to do a lot of messaging around to get people comfortable with the whole process? Is it something that people just sort of naturally came to fairly easily? Can you talk about the kind of investment you need into the messaging for shelter guests and staff?
Yeah, I mean, I think the messaging is super important. We had been doing screening testing similar to other cities at a less frequent cadence, like monthly, prior to our surge in December, where we really needed to do it a lot more frequently for it to be effective. And I think the change to saying we're offering testing 2 times a week was a big change. And I think we tried to message that, the more frequently we do this, the better snapshot we're going to get. When we look at our data, certainly the less than 5% of folks are testing with us 2 times a week through the last 2 months. You know what I mean? So we're not capturing the same folks every time. That said, we identified, several small outbreaks, and really they didn't progress further than 3 to 5 cases because we were able to identify those folks. So I think when you look at how many people you have to test to get one case to kind of tip you off, it depends on the size of the shelter and the size of the cluster. So I think still offering testing is worthwhile, even if people aren't going to completely participate every single time.
Great, thank you so much. Great information, and thank you, Michael, for putting links to the playbook and some other resources in the chat window there. If you have any questions, please feel free to type them in the chat window. Just thank you so much. This is fantastic information. Next, we're going to go to our next presentation. This is a very different topic, so just want to recognize that change in direction here, but we're going to talk about the Idis system, Integrated Disbursement and Information System. So I'm going to turn things over to Heidi Schulp, and she's going to talk about some TA resources we have around this. So Heidi, I'll turn things over to you.
Perfect. Thank you so much, Norm. And first and foremost, can everyone hear me? Yes, thank you for that nonverbal feedback. Fantastic. Next slide, please. Today, I'm just going to steal a few minutes of your time and go over some very, very, very high-level overviews for IDIS, and then hammer in a few updates based on things that we're seeing, questions coming through previous office hours, questions that we're seeing come through the IDIS Ask a Question tool, and then, of course, end with resources so you can get much more detailed information than what I will provide today. First and foremost, IDIS, or Idis, is the Integrated Disbursement and Information System. It is the online grants management system that HUD uses for its CPD programs, so CDBG, ESG, Home, HOPWA, Housing Trust Fund, and each of those programs, unfortunately, has its own setup and reporting requirements. So if you are an ESG recipient and you also administer HOPWA or Home or CDBG, you are probably well familiar that they all have different program rules and they all do things a little bit differently because that's how the world works, and it is what it is. So what I'm going to talk about today is mostly only applicable to the ESG program, but of course, my very next bullet point is applicable to all programs. HUD uses IDIS to monitor program performance, and so specifically for the ESG program, looking at the CARES funding, we're really looking at IDIS for that financial information. So looking at activity funded amounts, activity draws, and that's really where we're getting the information from. And we do get this question pretty often, but IDIS and SAGE and HMIS, they don't talk to each other. So if you just updated and uploaded your QPR into SAGE, that information's not in IDIS. So I just wanted to put that out there in case you have that thought that it was there. They don't talk to each other. And I know finally this was mentioned last week, but it bears repeating. Please log into IDIS often. If you don't, you'll be deactivated after 90 days of not logging in, and you will spend much more time getting back in than it would have taken you to just log in every month. It'll be easy peasy. Just log in, there you go, log out, you're done for a month. If you miss it that month, you'll catch it the next month, but there you go. Next slide, please. I am going to completely skip the consolidated plan, the annual action plan, the CAPER. I'm skipping all of that, not because it's not important, it is, but really want to focus today on some things that we're seeing with IDIS activities and give you some helpful information. First and foremost, the ESG program in IDIS has a very, very specific setup requirement for activities. And so if you are working with 17 different rapid rehousing providers and they're using both CARES funding and fiscal 20 funding, you're still only going to have one rapid rehousing activity in IDIS for the year 2020. So the activity level in IDIS is really just that big original 6 ESG program components. So it's admin, data collection, homeless prevention, rapid rehousing, shelter, and street outreach. The newer activity categories that were included as part of the ESG CV notice, they are incorporated into those activity components. And I will leave one of the last resource that I'm going to list you with is going to have all of that information broken out. So don't worry, I'm not skipping it. I'm just trying to highlight the big picture. One thing that we are seeing in IDIS, and we're starting to get more and more questions about it, is where am I supposed to document what I'm doing with my funding? And as the ESG CV notice provided, you have to include that in the activity description. The max of 4,000 characters, not words, characters. And that's where you're going to document how your organization is using its funding to prevent, prepare for, and respond to coronavirus. So if you haven't logged into IDIS this month, log in and check out your activity descriptions, and that way you can make sure you're in compliance with the notice. And again, if you are funding an activity with both your CARES funding and your fiscal 20 funding, it's still going to be in the same singular activity. Next slide, please. So this is a screenshot of the initial activity funding screen in IDIS. And the reason I wanted to highlight this is it is absolutely paramount that when you, as an ESG recipient, again, this is just for our ESG recipients, not for our local providers, but you're seeing a little bit behind the curtain here, if you will. For your ESG recipient, when you log into IDIS and you go to fund those 17 providers when your homelessness prevention or your rapid rehousing activity, this is what it's going to look like. And for some inexplicable reason, all of the CARES fundings have a source type, those two little letters that I have highlighted in green there, that's going to have a W in it. It's going to be in a DW if you're a state, an MW if you're a metro city, an SW if you're a territory, and then finally a UW if you're an urban county. They will all have a W in them if it's CARES funding. So if you see a W, it's your CARES funding. But this is important because when you go to your 2020 activity, you're going to see two lines in IDIS, and you've got to pick the right one. So if you're looking for your CARES funding, you're going to look for the one that has a W in it, and you're going to select the Add Edit in the applicable row. If you're looking for your fiscal 20 allocation, it's going to be in a completely separate row, and it's not going to have a W in it. And so you'd want to select the Add Edit for that line of funding. So I really wanted to hammer that in because the funding is really, really important. Next slide, please. So moving into the next piece of activity funding, remember you have one activity per component. So really where you're putting in a lot of information in IDIS is at this funding level. This is where you are going to identify the specific organizations that you have a signed agreement with. So the organizations, again, that you have an agreement, not the organizations that organization has an agreement. We're only going one layer down in the matrix, if you will. So this is that listing. And when you log in and when you first go to this activity, the default name listed there will be your organization's name. So if you're from Baltimore, it'll say Baltimore. If you're from the state of California, it will say California. And you can just go ahead and hit that change organization, and you'll be presented with a whole bunch of options on how to search for organizations, and you will identify the very specific organization. You'll include a funded amount, and you can hit save. There is no limit, or at least we have not found a limit yet on the number of subrecipients that you can add in an activity. I've worked with states that have 100, so we haven't hit the limit yet. So don't feel like, oh, I can only put in 2. No, you can put in much more than 2. So I really just wanted to clarify that in the activity funding screen. Next slide, please. The reason why this is so important to pick the right funding when an ESG recipient organization, whether it's program staff or fiscal staff, log into IDIS and go to create a voucher. When they create that voucher, they're doing it at the activity level. And at that activity level, the funding is going to have a different source type. So you're going to look for the W if you're looking for your CARES funding. And you can see you're drawing money by organization. So it's by activity, by grant, by organization. So it's very, very specific. And for those of you who are local providers and you are submitting invoices to an ESG recipient to get reimbursed, this is why it's really, really important to identify what is CARES funding, what is not CARES funding. That way the ESG recipient can draw from the correct grant. So I know that was very technical. I wish IDIS was a prettier screenshot, but I tried to spice it up with 2 colors because that's all I can do. Next slide, please. And some just quick reminders about vouchers. There is no one set way, and every organization does it differently. You know, there are some communities where it's a completely different fiscal department that does all of the vouchers. Other organizations is more of a 2-person shop and they do everything. So really, this is more applicable for if your organization is drawing money from your own internal line of credit. Your city, your county, your state has its own line of credit. You draw from that. you're reimbursing your subrecipients within 30 days of a complete invoice package, and then reimbursing your own bank account from IDIS much later down the road. Coordinate with those staff. See what the gap is between the time that you're drawing down from your local credit and reimbursing from IDIS, because HUD doesn't know when you're drawing down from that local line of credit. They only know when you're drawing from IDIS. So just coordinate. It might, in the past, if you were drawing quarterly, your fiscal staff might just say, well, that's what we're required by the regulation, so that's all we're going to do. Maybe just, have a cup of coffee virtually and just go over why it's important to make sure that reimbursement is happening from IDIS, especially as we get closer to our expenditure deadlines. We've got our first progressive expenditure deadline coming up, less than 6 months now in September, where 20% of your funds need to be expended. So we're really watching those draws in IDIS. And then finally, vouchers cannot be revised from one grant to another. So again, if you are providing a reimbursement request to an ESG recipient, it's got to be very, very clear for the recipient what's a CARES, a voucher, what's a non-CARES voucher. That way it's drawn from the right grant, because IDIS cannot revise it from one grant to another. Voucher errors happen, so they can be revised within the same grant, but not from one grant to another. And then I do have to, admin draws are slightly even more different because there's a different fund type involved for those. That way you don't exceed your admin cap. So admin draws, they can only stay to other admin draws. So be very careful in identifying what's admin, what's program related, direct delivery costs related to carrying out a program. Next slide, please. And finally, just wanted to leave you all with some resources where you can get more information. First and foremost, if you have a question about IDIS, please submit a question to the IDIS question pool on the HUD Exchange. When submitting your question, there's a little drop-down menu. You can select the Integrated Disbursement Information System. I am very biased. I manage that pool. And there's a super cool team of people who will answer your question. We answer well over 80% of our questions within 2 business days. We will get you a response back. And then if you don't have a technical question or you just want to look for more resources, here is a link to the IDIS resource page on the HUD Exchange. There you can find the IDIS manual. We are currently in the process of updating it because we had a new system release go live over the weekend. So it'll have lots of new updated screenshots in there. There's a whole host of webinars on IDIS there, how to run reports, how to revise vouchers, how to, use reports for financial management. There's a lot of webinars there. And then finally, I did want to leave with the specific webinar that was done October 2020 on setting up IDIS for the CARES grant. And it is very detailed oriented and includes a rather long demonstration of me logging into IDIS and actually going through all of these screens. So if you need that level of help, that webinar is there for you. And with that, thank you so much for your time. And if there's any questions, I'm happy to answer them.
Great, thank you so much, Heidi. Great information, and strongly encourage you to take a look at those resources. And please reach out for, that's an all caps shout out there, Heidi. So well done in the chat window there. Thank you, Stephen. But if you need additional help, please, as you can see in that link there, please feel free to reach out. We are delighted to help you figure this stuff out as much as quickly and as helpfully as possible. So next, we're going to turn our attention over to talk about expenditure in the ESG CD program. So I'm going to turn things over in a second. I'm going to turn things over to Sharon Singer. Before that, I want to remind everyone that we did have a poll question. We're going to post that. Thank you, Micah. We posted that link there. Again, you can still go in and respond to the poll question. These are questions about submitting QPRs and some of the challenges with doing so. And you can do this right up until the time this webinar ends, essentially. So encourage you to do that. And I'm going to turn things over to Sharon Singer, and she's going to talk about where we are on ESG CD grants. Sharon, take it away.
Hi, folks. Thanks to Heidi, who is our IDIS guru. And that was a nice follow-up to last week's poll questions I really think it ties to, our concerns in seeing the draws continuing to be low for the ESGCV grants. As you can see, we are inching upwards in terms of the funds in IDIS, the funds that have been committed and draws, but it is continuing to move slowly. So we, as we do each week, we really want to have you keep your eye on that 20% deadline, and we'll be doing more outreach to you as that deadline gets closer. If you can go to the next slide. And so this slide that I show you each week this really ties to what OMB, the budget folks, think about, is like, do we have our funds up and ready to be used? So they both want the funds up and in IDIS, but also out the door for the expenditure. So we are very close to getting the last of the first allotment. Only 6 more grant agreements need to be signed, and then we're down to 57 in the second tranche. So that's all really good news. So there is definitely movement on that end, but that's really sort of the first step in the process, and the last is getting things moving. So to Heidi's point, there are a lot of resources already, but per last week's poll, we will try, and if there's additional guidance needed, we're going to put our heads together with Heidi and other kind of folks who know IDIS and see maybe where there are some points where people are getting stopped from having that those expenditures done. So I am going to turn to this week's poll. We had 3 questions in there, and thank you, Micah. Is there any way to make that slightly bigger? I have the questions separately, but it's hard to read the pieces underneath. But I'll do my best. So it looks like we've got low numbers replying here. So I know IDIS and quarterly reports are not what we wake up in the morning thinking about, or maybe it is for some of you. But if you can continue to reply, as Norm said. So it looks like for the first question, what are the biggest challenges that prevent timely submission? So it sounds like some people say that it's a little bit too complicated. That's the first one. It is very different from the CAPER. We also had one response around subrecipients did not clearly identify who their subrecipients were, so subrecipients. It looks like the biggest one that we have 5 votes for is obtaining the financial information on expenditure detail in a timely fashion has been difficult. And I'm curious if that is from people within your team or within your organization getting that information. So that would be sort of a helpful piece to know what the hiccup is. It looks like there are 4 votes for the jurisdiction did not add staff or reduced my other workload to do this. So we know that people are super busy and that this is an additional requirement, but this is really an important tool for us as HUD and for you all to spell out the activities that you're doing and to show all the good work that is being done. And the last one is, let's see, well, so the NA, so we got a few people where this is not. Anyway, so feel free, like I said, to keep adding your responses there. We can go on to number 2. So number 2 is if your initial report or Q1 report was rejected, what are the issues that you had with the rejection? Check all that apply. So the last one looks like most people never had a rejected report. Yay, we have the good kids. So that's good to hear. And it looks like we did have a few folks who had rejections. It looks like sorry for the dog. The rejection information in SAGE was not clear, and you didn't know what to do to be corrected. 2 folks also say the bundles in SAGE are locked after submission, and we cannot correct our mistakes. And then the other set says the financial information report is different than what I'm used to, and I don't understand what is wrong. Those were the key issues. And while you go to 3, I'm going to grab some dog treats. Hold on. I wasn't prepared today. All right, number 3, how can HUD minimize the challenges of submitting timely QPRs? Check all that apply. So it looks like we have 6 for, is that the NA? And it's an internal issue that we need to address. Again, if there's anything from the HUD end that we can help with sort of streamlining processes, let us know. It looks like the second one is publish an FAQ document for the QPRs, and that is definitely something that we can look into. William Snow is our QPR master, so we will talk to him about that. And it looks like we also have input about providing additional trainings on completing QPRs. I'm not looking at what's in the chat, but we will look at any recommendations that you have. And it looks like we could provide some more thorough response when rejecting the QPR, and we should reach out by email or phone to assist. So it does sound like a little bit of additional guidance could be helpful. And I know that the CARES Act staff have been reaching out over the last week or 2 about your QPRs, and we will do our best to provide any additional guidance that is needed. Anything else from Norm or William about our poll results? We really appreciate folks sharing this information. It's helpful for us to have this information in real time and for us to be able to assist with issues that are causing pain points.
Thank you so much, Sharon, and thank you for everyone who responded. Please feel free to, if you just thought of something, go ahead and type it in the chat window. You know, we're not super formal about collecting information. We just love to hear your feedback about how we can make the process work better. Thank you for that. We're going to go to our Q&A portion here. And so there have been a few questions that I want to sort of take a step back and address. A few questions related to the homelessness prevention component of ESG, and especially as it relates to the eviction moratoria and other things. So I want to take a big step back here from sort of the details of the policy and explain the overall sort of goal of the policy and the intent of the policy and sort of what context this occurs in, and then we can talk a little more. About the details. I will say there's actually a really good technical assistance document that we developed a little while ago. We'll put the link to that chat window here. We developed. I'm sure many of you have seen it. We developed it back in July or so. I don't remember exactly when, but it's still very relevant to the questions we have today. So the question we often get is, okay, somebody is a renter well behind on their rent, and they would have become homeless but for an eviction moratorium. So can we provide homelessness prevention assistance? So I'm going to take a sort of step back from that and explain, like, what is the purpose of the homelessness prevention component of ESG? And I think the important context here is that it is very literally intended to be a homelessness prevention program. And so one of the key criteria is that the individual or household that you're intending to serve is actually likely to become homeless in a very short period of time. Now, and there are different ways to evidence that. The one common one is that you have some sort of notice from a landlord or property owner that a person has to vacate the premises within 21 days. So that's one of the things that you can use to document risk of risk of homelessness and that a person is in that at-risk category. There are several other things. They're actually spelled out fairly clearly in our regulations and in some of the other documents we've produced. And so then the question comes up, well, but the eviction moratorium has prevented landlords from being able to file those kinds of eviction notices. So are the policy, it's not like we have a policy that if an eviction moratorium is in place, you can or can't do something. The policy is just the same as it always was. If a person is going to be evicted in the next 21 days and there's some sort of notice of eviction, then that person is going to be eligible for homeless assistance. The fact that the eviction moratorium is the thing that prevents that isn't actually super relevant to the conversation. It's that that you need some actual indication that a person is likely to become homeless, and if they aren't, then that's not really the purpose of the homelessness prevention program. So that leads to a couple other questions. There's a lot of the instability that's caused by being behind on rent. So these are households that clearly need assistance. So what do we do in those cases where maybe they're not going to become homeless during the period that the eviction moratorium is in place, but they keep getting behind? It's building up their risk for the future. So the most important thing I think we can suggest is that there are actually a lot of resources out there that are specifically designed to address this very problem. The most important one is the Emergency Rental Assistance Program that is operated by the Department of Treasury. This is a program that is funded with, I don't remember the precise amount, maybe somebody can type it in the chat window, but I think they're up to about $45 billion in funding that is available for that program. And that is literally designed and intended to help people who are behind on rent because of COVID and who may be covered under an eviction moratorium. It doesn't really matter, but it is the program that is designed to help people who are behind on rent. So we strongly encourage you to work with your state and local governments to utilize the resources for that program. It's in many ways just easier to use than ESG because, again, it doesn't have this very specific purpose of preventing homeless episodes. It has a more general purpose of helping people who are behind on rent. So strongly encourage you to look at that. So the other question we get is, well, the eviction moratorium is in place, but people are still being evicted. Landlords are finding other ways around it, or the eviction moratorium doesn't cover everybody. So that is a case where, people may be eligible for homelessness prevention assistance, even if there's an eviction moratorium in place. So for example, the moratorium really only covers people when they are who might be evicted solely for non-payment of rent. But I think we all know there are actually a lot of reasons that a household may be evicted, and those households may very well be eligible for homelessness prevention assistance. It is, again, if you look at the sort of the program requirements, if a person has an eviction notice, they're going to have to move out in 21 days, and they meet the income test. They're going to be eligible for homelessness prevention. If a person is doubled up and whoever's they're living with is going to kick them out, they're not covered under an eviction moratorium, they're going to be eligible for homelessness prevention. If someone's exiting an institution, they have no other place to go, they're going to be eligible for homelessness prevention. So there are a lot of cases where you can actually use homelessness prevention assistance. I'm not going to go through all of them here because it's actually a lot of stuff, but we do have, again, that document that I talked about earlier, and also we have a lot of resources on homelessness prevention on that exchange. We'd really encourage you to take advantage of those. And so the other question that we've gotten and it's come up is, okay, well, I have a homelessness prevention grant. So whatever your process was, your state or local government gave your organization a grant to do homelessness prevention, and we really are only positioned to help people who are currently covered under an eviction moratorium. And so they're not likely to become homeless in the next 21 days or meet any of the other categories. So what do we do? And I think there are really a couple different approaches you can take. And again, without, everybody's circumstances are different, so I'm going to talk about these generally. But the issue, so one option that's always available is you can reprogram funds. So something is currently, homelessness prevention, but you can work with your recipient, so your state or local government. You can work with the HUD field office. You can work on reprogramming these funds so that they can be used for something else, like rapid rehousing. There, I think, I am not aware of any place in the country where nobody is becoming homeless currently. So I think there are likely people who are eligible for homelessness prevention assistance. Again, we are happy to provide some technical assistance, or I think working with your continuum of care. You might be able to identify, well, what are the circumstances, even with an eviction moratorium, what are the circumstances under which people are experiencing homelessness and becoming homeless? And what can we do to address those and design our homelessness prevention program to address those individuals? So I just wanted to go through some of those bigger topics here because they're things that have come up repeatedly. Again, encourage you to look on the HUD Exchange. We have a lot of resources there available that talk about homelessness prevention, and encourage you, if you have additional questions, to go ahead and send them in through that window. So we've got a couple other questions here. Marlisa, we had a question about the expenditure deadline, and what is the expenditure deadline exactly? Like, what is the technical requirement for what they need to do? Is it incurring a cost? Is it obligating funds? Is it drawing down funds from Idis? Can you talk about what that September deadline actually is and what we're going to be measuring?
Sure. So expenditures under the ESG program include incurred costs and cash disbursements. They're actually outlined pretty clearly in the regs at 576-203B. So if you want a really specific definition of what's included in expenditures, you could look there. But we use the same definition of expenditures for both annual ESG expenditure requirements as well as ESG CV. So when it comes to the September 30th, 2022 deadline, we're looking at an absolute minimum for you to have incurred the costs. If you've actually done a draw, great, but we would have considered you meeting the expenditure deadline if you would have if you have incurred 100% of your costs by September 30th, 2022. For both the annual ESG, for the ESG program in general, including both for annual funds as well as ESG CV grants, we follow Part 200 when it comes to the draw requirements. So you have 90 days after your period of performance end date to have fully drawn out all of those funds. So if you've incurred costs, you just haven't done your draws yet, you'll have 90 days, within 90 days after the September 30th, 2022 deadline to pull all of those funds out of IDIS.
Draw down your funds as quickly as possible. Sorry, I was on mute for part of that. Let me repeat. Marlisa gave you the technical answer to that. I want to also very, very strongly encourage everyone to draw down funds as quickly as possible. We are certainly, as you can see from Sharon's earlier presentation, we are paying close attention to how often funds are expended, but also how quickly they're drawn, and encourage you to draw down funds as quickly as possible. If you have questions or need help about it, please don't be shy about reaching out to us. Many of your peers, I promise you, have reached out to us already, and we have been able to help them work through challenges, and no question is a bad question in this area. We're more than happy to help with that. So thank you. I also wanted to, there's another question here that I wanted to cover really quickly. And Marlisa, I'm going to send this one to you again. This is about deposits that are paid through rapid rehousing, ESG rapid rehousing. So when ESG funds or ESG CV funds, I think the answer is the same, when they're used to pay for a deposit, when the person leaves the unit, what happens to that deposit funding? What are the options here?
It's up to the recipient to have a policy about whether the security deposit has to be returned to the recipient or to the provider, or if the tenant could actually keep the security deposit. We realize that, you know, it could actually be really administratively burdensome if you're trying to track down a security deposit like 5 years or more even after the ESG assistance has ended. So it's important to just have a policy that's documented and then make sure you're enforcing that policy. So if it is your policy that you want the landlord to return that deposit, then you should be sure that you're enforcing that and making sure you're tracking down the deposits once the tenant leaves the unit. But otherwise, you know, just clearly document that it's okay for the landlord to return that deposit to the tenant, and that's also acceptable.
And this is Brett. I just put an FAQ in the chat that has all of that in writing.
Great, thank you so much for that. Well, that's all the questions that we're going to be able to answer today. I want to thank all of our presenters, Liz, Heidi, Lindsay, great presentations, great content. Remind everyone we'll have this whole webinar posted next week sometime. Want to thank all the people who are behind the scenes, both responding to questions and making the logistics of this webinar run very smoothly. Those of you who have been with us from the beginning know that we've learned a lot as we've gone and things just run much smoother. So that's all because there are a lot of people behind the scenes making this work. And again, I know I do this every week, but I feel pretty strongly about it. I want to thank everyone who's working to keep people experiencing homelessness safe every day and to help end their homelessness, help prevent their homelessness. You do incredible work, and we are so deeply appreciative. All this stuff is very, very hard to do, and I think the thing that keeps us motivated is just seeing what an impact you're making in your communities. So thank you so much. Want to just again thank everyone and wish everyone a happy rest of the day and a great weekend. And that concludes the webinar.